we offer much more than that. We offer the brotherhood that we subconsciously want so bad and that we've been used to, you know. Used to have high anxiety, hypervigilance, depression, all that stuff. And you know, I still do have it for the most part, but I'm able to control it now. I know when I wake up in the morning that I'll go to bed just as happy as I woke up in the morning, and I don't got to worry about spiraling out of control with something that I didn't see coming, you know. And that's just little things, like somebody looking at you the wrong way. You can think, that guy's out to get me, or you know, just little things like that spike your hypervigilance. And I don't got to deal with that anymore. I can just put it away.
The best way to relate mindfulness to those that are in the Canadian Forces awaiting release or transitioning is that it's your situational awareness. When you're in theater, you better have situational awareness. Hence why they come back, or we come back with hypervigilance. Mindfulness is being aware of your surroundings, all right? Looking inward and understanding what's going on, and being present. Learning how to do that takes time. It's very difficult, actually, to take time out for yourself and be present and thank yourself for one day. That's tough to do. So when you take an ego-driven military guy who's trained one way and try to make him mindful, it's very difficult. It takes a lot of practice. Cannabis helps with that practice. There's no prescription drug that I've taken, that I'm sure Chris has taken, that has helped us be mindful. Like Andrew said, it turns us into zombies. Causes erectile dysfunction, makes you gain weight, can't get off the couch, can't have sex with your spouse. What kind of life is that? They wonder why the divorce rate's so high.
If we are going to be an evidence-based community, that we should certainly look at the evidence for medicinal marijuana, and we should use marijuana where the evidence says that we should, and we should not use marijuana where the evidence says that we shouldn't. The current data does not suggest that pharmacotherapy is effective for treating veterans for PTSD, but we do have good quality evidence that a lot of veterans do very well with cannabis use.
So a client, Andrew, came into Marijuana for Trauma a few months back with shaking so bad he couldn't hold a cup of coffee. I arranged for Andrew to try cannabis called Avidecal, which is a CBD dominant strain that does not get you high. I could not use CBD and get relief. Andrew, however, vaporized 1 gram of cannabidiol, and in 3 minutes went from violently shaking to completely stopped and able to have a complete conversation. And when I seen that with my own eyes, you know, so many things were going on in my head that people need to see this. People can't think that cannabis has no value, no medicine, no place in the medical world. It does. Even if it's only for Andrew, and he uses a different cannabinoid, and he doesn't get high. Soldiers aren't out there just getting high. We're feeling normal.
They're also assigned a cannabis coach, and the recommendation is to vaporize the marijuana, and oftentimes patients use something like this. It's about $300, and Veterans Affairs Canada covers $300 every 3 years.
What time are we at, Corey?
We're at 3 minutes and 22 seconds.
3 minutes, 22 seconds after using 3
3 vapor bags from the volcano and approximately 1.5 grams. Andrew's shaking has stopped almost completely. It's only ignorance amongst healthcare professionals to deny somebody access to such medication.
This is a band-aid solution to a gaping wound.
As I said before, there is no cure for PTSD. So yes, it's a band-aid. It's the best band-aid to control our symptoms. You still need treatment for your injury. You need neurofeedback, you need psychotherapy, you need family support, you need peer support. Then you need to come to a retreat, or you need to learn how to connect with nature and love yourself again and love people around you. So is it a band-aid? Yes, it's a band-aid. I didn't need this medication before I joined the military and for 7 years, but I need it now. And when I don't, I'll give it back. I'll stop taking it. And we all agree on that. Please contact info@mftgroup.ca and our team will help you. You will find relief if you have PTSD and you're suffering right now. That this isn't just medication. We want you to be part of our family. All right, be part of a trusted group again that really has your best interest at heart. Cannabis just happens to be one part of what we do.
It doesn't work out here. You don't have to be alpha. I get in the military, it's all about being the best. You know, from what unit you're in compared to the other unit, from what company, you know, platoon, section, fire team. It's always a competition. It doesn't work out here, and in a lot of cases, it's a fast way to the grave. Honestly, if you keep sucking it up and trying to be Mr. Alpha or Mrs. Alpha, it just doesn't work.